Which of the following is the most likely cause of these findings? A 65-year-old man with a history of hypertension and smoking presents to the emergency department with severe chest pain, diaphoresis, and shortness of breath. His vital signs show a blood pressure of 90/60, heart rate of 110, and a respiratory rate of 24. An ECG reveals ST segment elevations in leads V1 through V4. The patient is diagnosed with an anterior wall myocardial infarction and treated with thrombolytics. 3 days later, he developed sudden hypotension, tachycardia, and a new holosystolic murmur at the left lower sternal border. Which of the following is the most likely cause of these findings? Okay, my immediate thought was like there was a rupture of some kind, especially because I'm thinking now it's like a VSD, especially because like it's like 1 to 3 days is like neutrophils, 3 to 5 days is like macrophage in macrophage level of like that's when they come in. So my immediate guess would be interventricular septal rupture. Um, to me, it can't be. I mean, it's not aortic dissection in my opinion. That would have some type of like discussion about like, oh, you have two different blood pressures in the two different arms, something like that. They would say that cardiac tamponade would show muffled heart sounds, and they talk nothing about it. Or hypotension, JVD. So that's not talked about here. Papillary muscle rupture. Ooh, that could be it. That could be it. Papillary muscle rupture. Why is this one? Interventricular septal rupture or papillary muscle rupture. Tachycardia, new harsh holosystolic makes me think VSD over papillary muscle rupture. So that could be right, but I'm thinking it's still this one.
Yeah, best answer here, right? Little tachycardia, right? Holosystolic at the left lower sternal border, kind of where your intraventricular septum is. And so if you have a little perforation there, now you have like an acquired VSD from an MI, right? So it fits the picture a lot better. Papillary muscle rupture causes what?
It could cause like a regurg, like a much like a
Yeah, like a little regurg action, right? And so for sure. And then tension pneumo doesn't have anything to do with this. And then, like you said, cardiac tamponade, you got Beck's triad, right? That you mentioned really, really well. So yeah, the best answer is going to be C for sure. But definitely for sure, I like kind of if you notice kind of your question strategies, you pick your gut answer choice, right? A lot of things support it. You're kind of looking around and you're saying 70, 80% I'm right. You get what I'm trying to say?
yeah, yeah,
Good.
yeah.